As far as the U.S. is concerned, when you look at this, I mean, you had a little higher head count on the infections because of the cruise ship people coming off. We have contained this. I won't say airtight, but pretty close to airtight. We've done a good job in the United States. Hats off to our public health people.
I think what Kudlow meant by that is that it's not spreading within the U.S. In some countries, including Italy, South Korea, you're starting to have outbreaks, sustained transmission of the virus from one person to another, not just people coming back from China. What he's saying is the virus is not spreading here. Yes, the U.S. has cases, but the vast majority are from people who have been repatriated from China or from a cruise ship where there was an outbreak of the virus, that it's not actually spreading among people in communities. And those people are in quarantine, so he's saying, we're not going to have an outbreak, essentially. And that's kind of a dangerous message to send.
And I'm here with Linda Buffington, who is a registered nurse, and we're going to talk about what's going on and everything that's going on with the pandemic currently that we're facing today.
I graduated from school last May, so I have been working as a registered nurse for about 8 months now. School, they talked about crisis standards of care and having to rise to the occasion and take care of people during crises like natural disasters and stuff like that, but I feel like it was one of those things that everyone was like, oh, we don't need to know that, it doesn't apply to us. So I don't think we took it as seriously as we could have, because nobody could have predicted this. But everyone always says that your first year of nursing is the hardest, because you're adjusting from school to working, and you have to learn a lot of stuff on the job. So this has definitely made the first year a lot more difficult. As prepared as I could have been, there was no way to know though for this.
If there was ever a moment for unity, this, my friends, is the moment. In this situation, there are no red states and there are no blue states, and there are no red casualties and there are no blue casualties. It's red, white, and blue. This virus doesn't discriminate. It attacks everyone, and it attacks everywhere. The president said this is a war. I agree with that. This is a war. Then let's act that way. And let's act that way now. And let's show a commonality and a mutuality and a unity that this country hasn't seen in decades.
I definitely think they communicated as much as they could have, especially in the beginning. Nobody really knew what was going to happen, how bad it was going to get at the hospital, how many patients we were going to have, what steps we were going to take. So I think it was definitely everybody's very tense, and it's very stressful because everyone's on edge, not knowing what changes are going to happen, if there are going to be enough staff, how sick the patients were going to be. So it definitely kind of put everybody, nobody was really at ease. Normally going into work, there's always a little bit of stress, I don't know what patients I'm gonna have today. I don't know what they're gonna need. I don't know how sick they are. because that changes day by day, but it's kind of added an extra layer of stress. I've been getting moved around and being paired with ICU nurses to help them take care of their patient loads. You're on floors, you don't know where anything is, you don't know any of the people, so you lose a little bit of that comfort that you normally have. I definitely think that even if you aren't a healthcare worker, you can help by staying home, listening to the government, trying to shelter in place, going out as little as possible to make sure that if you do have it, you're not spreading it, washing your hands, making sure that you're following those guidelines. I feel like it's hard to kind of see improvement when you're in the thick of things working at the hospital, but I definitely think that this is gonna change how we live after this. Hopefully we're more cautious about, especially in like the immediate future, traveling, going out. I think hopefully it'll make people think a little bit more about like washing their hands, keeping things clean, like staying home when they feel sick and taking care of themselves. Also hope that this kind of serves as a catalyst for change for the healthcare system. Definitely think there are a lot of improvements that can be made, and hopefully after this we'll be more prepared for future situations should they arise. Like we'll have PPE stockpiled, we'll have systems in place to handle a large influx of patients, so that way if it happens again or when it happens again, we can handle it a lot better. I feel like there is a sense of community and solidarity. Even just feel like a lot of people are realizing how good they had it before and how we kind of took for granted being able to spend time with our families, to spend time with our friends and other people. So I feel like everybody's kind of gaining an appreciation for that, and it's kind of forcing us to spend more time talking to each other. I feel like even at work, it's kind of given me a greater appreciation of like the people that I work with. I did before, but I think not being able to work with the normal providers that I work with, the normal nurses that I'm normally on staff with, I realized how good a floor I had and how good of a staff that I worked with.